Thank you. Thank you. Everything has a cause. Isaac Newton gave us his famous laws of motion a few centuries back. And one of those laws was the most popular one that we all probably know by heart. The third law of motion, which says, to every action, there is an equal and opposite reaction. Newton believed that everything has a cause. And this is so true. We all are surrounded by the natural laws of this universe. And the iron law of this universe is the law of cause and effect, which says nothing happens without a cause. For thousands of years, different scholars, scientists, philosophers, and different religions may have disagreed upon so many points, but they all unanimously agreed upon this one particular point, that the laws of this nature are real. The law of cause and effect exists, and nothing happens without a cause. We tend to come to a conclusion about so many things that is non-scientific, ignoring the fact that there is always a possibility of a scientific cause behind anything that happens. Modern neuroscience today has given us the answers of so many of those questions that remain unanswered over the years. We now actually know the mysterious unknown. Today, I would like to address some mysterious unknown phenomena that are often confused with being supernatural or magical. And I'll give the scientific explanation of those phenomena. I'll address 3 psychiatric conditions that are often confused with being supernatural. So let's begin. So what is the first one? The unknown behind the mystery of multiple personalities. Yes. Have you ever seen a person or know a person who has multiple personalities, who changes personalities? We all probably have read about it, heard about it, or possibly we have watched that in the movies. Many of us confuse this condition with some kind of ghost or some kind of possession. But in reality, modern psychiatry has a different name for this condition. American Psychiatric Association today recognizes this condition as dissociative identity disorder, DID, previously known as multiple personality disorder. People with DID, they can have multiple personalities. They can have 2, 4, 10, 50, or maybe 1,000 plus personalities depending upon the case. Each of these personalities can have different names, different genders, different ages, and different behavior overall. So what causes DID? Scientists believe today that possibly they went through some kind of severe childhood emotional, physical, mental, or sexual trauma. That's why they develop these symptoms. We have functional MRI and structural MRI studies today that show us what happens in the brain of these patients. So they have orbitofrontal cortex region, the front part of the brain, according to a study, reduced blood flow is found in this region, in these patients. So this possibly explains why they have problem with impulse, because this area is associated with impulse and decision making. We also have other studies that show that they have reduced size of the hippocampus region, which is associated with memory. This possibly explains why they forget about one personality while under the influence of another personality. And they also have amygdala, as the part of the brain that is affected, it has reduced in size in many patients. This region is associated with emotions. This possibly explains why some of these patients can be overly aggressive. So this is a real condition. This is a real medical illness, recognized medical illness, a psychiatric illness. Some patients also can have imbalance of some chemical in the brain, usually GABA. We don't have a medication as of yet to treat this condition. The best treatment that we have so far is long-term psychotherapy. However, as the time passes by and the way science is progressing, we expect that one day we will have medication to treat this condition. So next time, when you hear about someone changing personalities, don't think of supernatural phenomena. Think of DID. Let's move to the next one. The next one is the unknown mystery of the ghost that bothers you at night. Yes. Some of you have felt it, and you possibly know people who have reported that I was sleeping at night and a ghost was sitting on my chest. He was grabbing my neck. I wanted to move. I could not move. I wanted to breathe. I could not breathe. Sounds familiar. Many people confuse this condition as supernatural or possession. A ghost has attacked, they feel. But science today has a different name for this condition. This condition is known as sleep paralysis. It is not a recognized mental illness, but it is a condition associated with other mental illnesses. For example, generalized anxiety. So what happens in sleep paralysis? Scientists believe that there is an overlap between the REM sleep, the REM sleep, and wakefulness. Certain regions of the brain are affected as well. As you can see, this is a very famous photo. This shows how the symptoms are. Scientists believe that the pons and the medulla region of the brain are affected in this condition. We don't have any treatment, a medication treatment, or a drug treatment for this condition, but long-term psychotherapy can be used if somebody is overly stressed out because of anxiety, but usually this condition is treated with disciplined sleep or sleep hygiene. Now let's move to the third condition, the unknown of seeing and hearing things that don't exist. Do you know somebody who told you that I can see things that you don't, or I can feel things that you don't, or possibly you feel that? Don't think it is a supernatural condition. This condition has a name in science. This condition is known as schizophrenia. This is a recognized mental illness, recognized by the American Psychiatric Association, mentioned in DSM. Schizophrenia is a real condition, and people with schizophrenia can have hallucinations, illusions, and delusions. They can see things that others don't, that's hallucination, or feel things that others don't. Illusion, they can confuse things with something else, and delusion is usually the false belief. And by the way, these symptoms can also be an indicator of psychosis, which can actually point towards another mental illness like bipolar disorder or substance use disorder. So this is a real condition. Research evidence has shown that almost all regions of the brain are affected in this condition. Frontal lobe, parietal lobe, the temporal lobe, and the occipital lobe. All of these regions. The blue is the frontal lobe, and the pink one is the occipital lobe. Yellow is the parietal one. They also have enlarged ventricular size as well. And they also have chemical imbalance as well. We do have medications to treat schizophrenia and psychosis symptoms, antipsychotic medications. And the best treatment so far is antipsychotic medications combined with psychotherapy. That's how we manage schizophrenia or psychosis. So next time, don't confuse this condition with something supernatural. When you hear about these symptoms, think of schizophrenia or psychosis. We have other phenomena as well, but the time does not allow us to go into the details of those phenomena. I'll keep them for some other time. So, what did we discuss today? We discussed that there are certain psychiatric conditions that are often confused with being supernatural. Schizophrenia and DID are psychiatric illnesses, while sleep paralysis is a condition associated with other illnesses. All three of them could be confused with something supernatural. There is nothing supernatural about them. They are purely scientific. I'm not against supernatural, and I'm not denying supernatural. What I'm saying is that when something is scientific, we should consider that to be scientific, rather than looking for a supernatural cause. And why it's important. Research evidence suggests that people with severe mental disorders are 2 to 3 times more likely to die earlier than people with no psychiatric disorder. And they are at risk of committing suicide as well. So if we keep looking for the wrong cause and we don't find the right cause, we may lose these people. And they could be your friends, family, your loved ones. So we have to save them. Because early detection, early diagnosis, and early treatment can really save their lives. So next time, when you hear about these symptoms that I discussed today, don't jump to a conclusion about them being supernatural or ghostly or magical. They are purely scientific. And we should always look for a logical and a scientific cause. Because if we can find the right cause, we can find the right solution. This is Dr. Hassaan Tohid with the scientific explanation of the unknown. Thank you.